So thank you. An interesting, thanks for that, Dan. And what an interesting topic it is to ask the question, does money buy change? I'm just waiting for my slides to come up. Maybe I need to advance. There we go. Yeah, so I thought long and hard about this, does money buy change? And here's what I've come up with. That, you know, when you look at all the leadership information that's out there, all the gurus around change management and leadership, what you will see over and over again is people will say, you know, what really needs to happen is you need to create that sense of urgency first. You need to light an organization on fire. You need to light people on fire so that they understand why it is we are trying to change. But what the literature will tell you, and what John Cotter and others have said, is when you really look around organizations, that sense of urgency is remarkably missing. And when I came back to Capital Health as the CEO, what I saw was an organization of mediocrity at best. There were lots of pockets of excellence, but what I saw when I talked with people was that many people would say, you know what, we're doing okay. It's just about everybody else. If only they would change, how much better the system would be. And complacency truly was alive and well in our organization. So I'm going to talk a little bit about what we're doing at Capital Health, excuse me, around change. I do believe that there is a place for money in our life, and that money can help us in the change journey that we're on by, you know, supplying technology, supplying some infrastructure. We have all used consultants at some point in another. But if we want to truly make sustainable change in our organizations or within ourselves, what I truly believe is that when you don't have any money, that's when real change happens. When I went back to Capital Health, the culture in our organization was this: just go downtown and ask for more money. That was the solution to everything. And despite all the money that was being poured into our healthcare system, our health outcomes weren't getting any better. In fact, they were getting worse. And our health system was absolutely not improving. So I did say to folks in our organization, I don't want to hear that word again. I don't want to hear you ask for more money again. We have a budget of $800 million. We have enough money. Let's figure out what we're doing with that money and how we're spending it wisely. And I've been there 6 years, and it's taken us that long, but I don't hear anybody asking for more money now. And last year, I mentioned this earlier today, last year we took $15 million out of our budget. This year we're taking an additional 19, and we will make those targets because people have come to the table in a very different way. We've created a sense of urgency. People understand that there is a burning platform, and that is that there is no more money, but the insatiable demand on our service is critical. Something about us in the healthcare world is really interesting, probably not like other organizations or businesses, in that we're quite insular in our work. There's so much out there for us to grab hold of, so many best practices for us to grab hold of and take, but we don't for whatever reason. And what we need to do is truly bring that outside into us so that we breathe some different air, we see some different spaces. This is really about moving to that transformational leadership, and that's what I want to talk to you a little bit about. You know, in my career and in my life, I will do almost anything people ask of me, but I'll do almost nothing people tell me to do. And it's a wonder I ever got to be a CEO with that kind of attitude. But, you know, that's just the way it is. And I think that that's generally what people are like, right? If you impose things on them, they aren't going to embrace it and do it. I love this picture because it really speaks to me about human nature. We see what we want to see. My grandmother used to tell me that she only knew she was old when she looked in a mirror. And I never really got that. I thought, how in the name of God, she was 97 when she died, could you not know you were old? Until now when I walk by a mirror and think, when did I become my mother? And you know that, you know, obviously we are seeing what we should be seeing. But this is what we need to do. We need to help people to see differently about where we're going. And I believe my experience has been that the key here for us in transformational change without money is about tapping into people's feelings. We can't change how people think. we can only change how we think and behave, but we can tap into people's feelings. Dan touched on this about reaching into people's hearts, getting them to understand their place, what's in it for them in terms of change, and getting them to embrace that. At Capital Health, what we did a few years ago is we started on a strategic planning journey that was different than anything we'd ever done before. We used the work of Otto Scharmer out of MIT in utilizing the U theory, and I'm not going to go into the U theory, it's a whole day's talk in itself, but really what this was moving us along a continuum to really engage people in what it is we needed to do, what we needed to be when we grew up. We talked with thousands of people in our journey. We went into soup kitchens and dockyards, churches and schools. We talked to people about change. What did they need from the healthcare system? What did they want from it? And what they told us was really difficult for us to hear, but it fundamentally changed for us how we went about what we needed to be when we grew up at Capital Health. The results for us, I'm going to touch on just a few things to demonstrate for you how we've been able to do some transformational change in our organization with no additional funds. We really have reached into that inner spirit of people and the innovation that we buried so long ago in many of us. I always say when I went to nursing school, it was beaten out of me. But, you know, we've been able to grab it again and really embrace it. We came up with a number of things through all of our work. One was our promise, which in old language we would have called a strategic plan. This really is about our promise to ourselves, to each other, and to those we have the privilege of serving, of how we're showing up differently in partnership with them. Our Declaration of Health was about every citizen who we came in contact with in our organization, and this was, you have a right to expect health care, but you also have a responsibility and an accountability to be as healthy as you can be. We'll be there as a formal healthcare system to help you, but this is a shared accountability. We've got a ton of work around this, and we're really starting to see some results. This was about a cultural transformation in our organization. Some of the tools that we used, I've listed here. I just want to touch on one of them for you in the interest of time, and that one was called My Leadership. What we figured out is, you know, we needed a leadership program to equip people in our organization to lead in transformational times, but we had no money to do that. And as we were brainstorming, we thought, wouldn't it be cool if we could tap into the hearts and minds of the gurus in leadership around the world? What if we brought them all together and really figured out what it was that we needed to equip our leaders around transformational change? But we said, how are we ever going to do that? You know, it's never going to happen. We can't pay for them to come here. Said, what the heck, let's just ask. So we sent out a letter to people all around the world who were gurus in leadership, inviting them to a 2-day session to say, you're on your own, it's your own dime, but you know, this is an opportunity to really create something very innovative and cool. And 60 people came from around North America primarily, who were gurus in the leadership development field, and helped us unbelievably in developing a leadership program that all 500 of our formal leaders went through, mandatory. We did it internally. We didn't use consultants. We didn't use anybody. We capacity built and developed that ourselves, and including me, every one of our formal leaders went through that program to understand and to have the capabilities to lead transformation. Now we've rolled it out to the 10,000 people within our organization. Thousands have done that. Our physicians, who typically didn't like to join in on those kinds of things with the rest of the teams. And we said, you know, finally, let's stop trying to put that square peg in a round hole. Let's develop something for our physician leaders or those who are interested in going into leadership roles that really is about what they need in leadership development. And so we developed a program called Fully at the Table, again with our resources based on best practice. And on we went. We're in our third cohort now of physician leaders. It's been wildly successful for us. Some examples of where we're going. A huge number of innovations on the clinical front. We are leading the world in some of the things that we are doing. First time happening in Halifax, who would have thought, but really doing some amazing things there. So really not talking a lot about the clinical side of the house, great things happening, but I do want to touch on a couple examples of how our commitment to a culture of transformation, how we're committing to what we're saying, that we're really going to make a difference, is happening And again, all done without money, but with the will and intention and excitement of people in our organization who we have set free, given them the wings to fly, and fly they have. So I want to touch quickly on our healthy food strategy just as an example for you, because we were talking at lunchtime with our keynote. One of the last questions asked of him was around healthy food, primary health care. He talked a little bit about the obesity issue, and in Nova Scotia, just like the rest of the country, but we're probably taking the prize for a lot of chronic diseases, and obesity is one of them. What we decided as a healthcare organization is we needed to do something different. We could not be talking out of both sides of our mouth, and this was not about our patient food, because we followed Canada Food Guide for that, but this is about the food we sold in all of our retail operations, our cafeterias, our corner stores that were inside our organization, our Tim Hortons franchises, all of those things. We put together a panel of some experts and some citizens who came forward and said to us, you know, here's what you should be serving as a healthcare organization. And 2 years ago in July, we turned off our deep fryers and went to all healthy foods within our cafeterias with a little bit of pushback, but people, you know, generally went along with that. And if they still want to get French fries, etc., they can go out to the chip wagons that are down the street and get those. But we have moved to that. In 2 months' time, all our chips, pop, chocolate bars will be gone from our organizations, and we've had to wait that long just because we've had some contracts in place. So we are making significant change in our organization with no additional money. Does money buy change? My premise is that it helps sometimes, but it does not create sustainable change. The culture in our organization has changed unbelievably. We have physicians who now come to the table and say, I know how we can save $1 million. We have people from our housekeeping staff right on up to executive offices who are talking about how we do things differently. We ended our year this year with a $26,000 surplus on almost $1 billion budget, so you know what we spent in a nanosecond. But the principle and the point is there, that when there is a burning platform, when people get it, when they understand, when you touch their heart, when they know how they can contribute to the future, huge change, sustainable change can happen. So I'm going to stop there and turn it over to my colleague, Michael.